Hello and welcome to Talking Pharmaceuticals, an interview series brought to you by Making Pharmaceuticals and Distributing Pharmaceuticals. I'm Victoria Emerton, Conference Director for the events which next take place in April 2025. And in the lead up, I'll be joined by experts from UK Pharma to share insights, opinions and practical advice, providing a fresh perspective on key challenges and opportunities in the industry and to look ahead to their involvement in the events. I'm delighted to be joined today by Dr. Siegfried Schmitt, Vice President Technical at PAREXEL, and also a member of the IMechE Pharmaceutical Special Interest Group. Hello, Siegfried. Thank you very much and welcome to Talking Pharmaceuticals.
Hello, Victoria. Very nice to meet you. Thank you for having me.
You're very welcome. So you're going to be giving two presentations at the event, one called Compliance and the other called Do Engineers, Operations and Quality Speak the Same Language? So we're going to be talking about that presentation mostly. So what do you mean by engineers, operations and quality speak the same language? Could you elaborate?
Certainly, Victoria. So it has to do quite a bit with my career, because I'm an organic chemist by profession, but I've also worked for engineering companies. I worked in quality assurance, I worked for consulting firms. So very different types of companies. And working for them, it brought me into contact with various subject matter experts, and they came from a different range of backgrounds. And there are, of course, a lot of technical terms that one has to learn about. Now, that in itself is not so problematic, but what I found is one technical term used by one group of people may have a completely different meaning, but it's the same term, it's used by another group of people. So what we need to understand is, of course, we all speak a language, but do we speak it because we are so immersed in it and we just think everyone else will understand us? Or is it just understood by a smaller group of people? So you could also say, well, okay, if you say engineering, then are there any glossaries of terms? Yes, of course there are. But these glossaries are prepared for one field of practice, say mechanical engineering. And very rarely, I found at least, do they really cross over into other fields.
That's really interesting. You hear the term, don't you, lost in translation, language to language misunderstandings, but I hadn't thought about it from a technical context. So is your presentation going to be about specific terminology?
Well, somewhat yes, but not specifically, because what I try to do in my presentations is to bring real examples, case studies. It's much more practical than using theoretical examples. So what I try to impress on the audience is that only through dialogue can you actually find out where there may be some areas of miscommunication. Well, one could argue, why worry? We always understand each other somewhat, somehow. Yes, that's true. But we are talking about the healthcare industry. We are talking about projects. And if we have miscommunications, even on a small scale, then this will invariably have an impact on these projects. It may result in delays to medicines or medical devices being available to patients. And so, although we can say, yes, it's just about communication, in the end, it's about patients. And we need to do our very best to bring the pharmaceutical drugs or the medical devices to the patients as quickly as possible. And let's not forget, all the projects will have a monetary impact, so think about cost.
Absolutely. Yeah. Speed of delivery, safety of delivery, quality of delivery, all very important. So you mentioned case studies there briefly. So your presentation sounds quite theoretical. Are you going to bring it to life with actual examples and case studies?
Oh, well, Victoria, I have to, because there's nothing more boring than you come to a presentation, you think you will learn something, and all you hear is theory. No, no, no. There has to be practical examples. Now, uh, as you can see, white hairs now, so 3 decades in the healthcare industry. It's not just getting old in this industry, it's also hearing a lot of stories, seeing a lot of things. And I was very lucky as a consultant working in many countries around the world. I could sample many, many examples. And what I mean here is they're best practices. And there are cases where you say, please, please, never repeat these mistakes again. Now, of course, what we know is there is limited time during the presentation for questions and answers. But what I say is there's always ample time during the event to ask further questions and discuss these and other topics. Because I also want to hear from the audience. They may have cases, they may have particularly interesting stories. So it's not just conveying something from me to the audience. It would equally be interesting to hear from the audience. And we have a total of 2 days. And I will be there for the 2 days, and I'm really looking forward to meeting many people there.
Absolutely, and that's the beauty of attending an event in person is that two-way exchange of information and sharing best practice. So we're really excited to have you at the event and looking forward to everyone that's watching this podcast coming too. So just to remind everybody, Siegfried's presentations are Do Engineers, Operations and Quality Speak the Same Language? And also a presentation with the title Compliance. So covering lots of bases. So attending the conference and the exhibition is free. Registration's open at www.makingpharma.com, and the conference programme is live on the website, so people can plan ahead and work out how best to use their time. Siegfried is coming with the IMechE, and they are on stand 823, and I'm sure you'll be available, as you say, during the event, being around and about and on the stand to talk to people if they want to come and pick your brains.
Absolutely, Victoria. And I really think it is wonderful to have these in-person events because it is the personal interaction that makes it so valuable. And it's so difficult to do anything like this virtually.
Indeed, indeed. So we look forward to seeing you. I'm really looking forward to meeting you. We've not met before, and to seeing everybody watching this podcast at the Coventry Building Society Arena on the 29th and 30th of April. Thank you very much for your time today.
Thank you, Victoria. Thanks very much.